give today's update and walk you through some changes to our dashboard today, and then we'll take your questions.
All right, good morning, everyone. Just as before I start my numbers, you will see that some of our case counts are going to be reflecting increases due to the addition of probable cases, according to the National Surveillance Case definition. Those probable cases are primarily due to the addition of antigen tests to the RT-PCR test that we have used as kind of the standard of detection for COVID-19 of those acute infections. And with the addition of those antigen tests as probable cases, and with the increasing popularity of those antigen tests due to cost per test and just the readily available number of those antigen tests, we are now including them in our overall case numbers. So with that, I'll go ahead and get started. So today we are reporting 609 new cases of COVID-19 in the state. Now of those, 562 are confirmed and 47 are considered probable. Now you will see the totals for the state increase by 1,030 total cases, and this is because we are also adding in 421 probable cases that were reported to be reported on the website today, included in those total numbers, but will show up on the date that they were received by Department of Health. So you'll need to look at that trend data in that trend tab for where those probable cases will show up. Today we're reporting 27 new hospitalizations, 10 new deaths, 1 from Beetle, 2 from Coddington, 1 from Lake, 1 from Lincoln, 1 from Meade, 2 from Pennington, 1 from Turner, 1 from Union counties. We have a total of 688 individuals who have recovered from COVID-19 and are no longer able to transmit the virus, and a total of 15,234 new tests that are being reported today. Of those, 4,059 are those new confirmed and probable cases that were received over the past 24 hours. And to that total, we're adding 11,175 of those probable tests, or those antigen tests that I mentioned. This does bring our totals for the state to 25,905 COVID-19, 25,906 COVID-19 cases. That does bring our totals for confirmed to 25,433 and probables to 473. We have a total of 4,511 active infections, 21,137 individuals who have recovered. We currently have 273 individuals who are hospitalized, a total of 258 individuals who have died, and our total tests are now at 309,841, and those are among 208,780 unique persons. I do have one additional update, is just the cluster updates. So we have the South Dakota Women's Prison, and information as of yesterday, we had 183 individuals who had recovered out of the 254 cases among both inmates and staff.
All right, with that, I will unmute unmute the lines, and we'll take your questions. We're ready for your questions.
Hi, this is Joe Sneevy with the Argus Leader.
Go ahead, Joe.
Can you explain a little bit more about probable infections versus confirmed infections, and when a probable infection might become confirmed, and where these tests are being taken to determine probability?
So, so individuals, as you identified, can move from being considered a probable case to a confirmed case if they have a secondary collection and sample submitted for that RT-PCR testing. which is the only positive test value that gets included in those confirmed cases. So you might see our probable cases decrease a little bit if individuals are being followed up by their medical provider and confirmatory testing is being conducted. As far as where the antigen tests that are considered those probable cases are maybe being used, because of the historical use of antigen tests being used in clinic settings, that is one of the primary areas that we will see these COVID-19 antigen tests being used. But we also are seeing a lot of new reporting from long-term care facilities that have received those antigen tests from the federal government and those machines in order to do that testing. We're also going to be seeing testing from other entities that may eventually include schools using some of the antigen tests being submitted to or provided to the state and provided to schools specifically for helping identify cases within school settings. And so individuals are going to be seeing a lot more of those antigen tests and a lot more of those antigen positives as we move forward.
Joe, this is Secretary Melsom Rice, and one thing I would just add is that probable cases are investigated and handled in the same way as confirmed cases. So anybody that has had an antigen test that's been positive is contacted by the Department of Health, and we use the same process for isolation of those individuals and identifying close contacts.
So just so I understand, make sure I understand this right, if somebody at a long-term care facility were to use one of these rapid tests and it comes back positive, that wouldn't be considered a confirmed test unless somebody followed up and took a second test through a more, the formal process.
Yes, that's correct. There are two different now tests that are able to detect active infection of individuals with COVID-19. And so the RT-PCR tests are what has traditionally been, and that was the first testing platform used. And over the summer, we have started to see manufacturers develop those antigen tests and look to see those used more widely into the fall.
Next question.
JP at KWAR News Radio.
Go ahead, JP.
Okay, you have the two different types of tests. How are the samples taken? Are they taken in a similar way or a difference? What's the difference between them?
So that's a good question as well. So when individuals are having a sample collected, it is traditionally for those antigen tests. It is just a quick swab of the front part of the nose, so it doesn't go further back like the nasopharyngeal swabs that are sometimes used for the PCR-based test. So the PCR, it really depends on what a laboratory has validated their test for. Traditionally, that has been on nasopharyngeal swabs, which typically go back much further into the nose. Most laboratories have also now validated their tests for the nose swab, so just essentially sticking a swab up and swirling it around the front part of the nose. And that is exactly what the antigen tests are using, as well as that nasal swab that swabs the front part of the nose.
Next question.
Yep.
Morgan from the Rapid City.
We'll go to Morgan.
Thanks. Okay, so just so I have this right, you would have to get an antigen test, and if it comes back as like a probable positive, then you would have to get a PCR test to verify that. And then if that's the case, why not just have these PCR tests everywhere? Why the antigen test if it requires two tests?
So, Morgan, this is Secretary Melson-Rice, and I'll just acknowledge that the word probable is not exactly intuitive, and I understand why you're asking that question, but I'll let Dr. explain it. I appreciate it.
Yeah. So, yeah, when we're talking about those antigen tests, they are considered, again, probable cases, but that does not mean that we're requiring individuals to collect another specimen on that individual. We at the Department of Health, when we receive that positive result from the antigen, we work that probable case, just as we would a case that we receive that's confirmed using the PCR platform. So it's only if clinicians decide to collect a follow-up sample and test using PCR that we would see some of those probable cases transitioning to confirmed cases. But again, it is not a requirement. It is based on clinician preference of, whether they want to submit another sample for confirmatory testing.
Next question.
This is Joe with the Argus. Yeah. When these folks,
We'll go to Stephen with the. We'll go to Stephen with the AP.
Yeah, I know that we've addressed hospital capacity. I just was wondering, because I spoke with the Cheyenne River Sioux Tribe Health Department, and they said that they had recently contacted hospitals around the state trying to transfer 2 patients, and that they had been told that those hospitals were on diversion status, so they had to transfer 2 patients out of state. I'm just wondering, as far as if the health department is tracking diversion status of hospitals in state, and how that works when a smaller health department or clinic needs to transfer patients out of state. Does that mean that there is a shortage of hospital beds?
Stephen, thank you for that question. So we do obviously monitor hospital capacity as well as the number of resources that patients with COVID are requiring on a daily basis. And so, the reason we will see diversions is due to a lot of different factors, and I think it's important that people kind of get the full story around why you might be seeing those. And so we'll see diversions happen at various times of the year in certain parts of the state, just due to just more activity in that particular part of the state, more need for certain kinds of beds. So we'll often see diversions in situations when there is more need for a particular type of care, and that can be anything from, ICU to psychiatric or other specialized care. So I would just tell you that there are different reasons that we will see diversions. As we look at the COVID situation here in the state, we've got 37 different facilities as of this morning serving between 1 and 61 patients. That's a favorable trend in that we have a lot of facilities that have developed the capacity to take care of COVID patients. We've got 10 facilities across the state using ICU beds for patients, and the number of those patients range from 1 to 14, and then we've got 3 facilities using ventilators for COVID patients. So we do actively work with the hospitals, and you'll see transfers throughout the state and within those hospital networks to make the best use of the available resources.
Next question.
Ray from Keloland.
Go ahead, Ray.
Hi. Yes, with regard to antigen testing, you mentioned it was more.
Ray, are you there?
You hear me?
We can hear you. We lost you for a second, but we can hear you now.
Okay. Sorry about that. Thank you. With regard to antigen, it's quicker turnaround and it's cheaper. Do you expect to be more antigen testing in the future as part of the plan for addressing the pandemic?
Ray, this is Secretary Malcolm-Rice, and yes, we absolutely do expect to see volume increase dramatically around antigen testing. Those are the types of tests that the federal government is providing long-term care facilities now to help with their testing efforts. In addition to the sentinel testing that we're also supporting those facilities with, it's also the way or the type of testing that is being provided to states and that we are currently deploying in K through 12 schools. And so by the end of December, we expect to receive 260,000 antigen tests from the federal government to help schools and other entities.
So just a quick follow-up.
Go ahead.
Can I have a quick follow-up? So you explained a little bit that these are probable, but treated as basically confirmed. How important is that for people to understand moving forward as we get more of these types of tests?
So I would say that the distinction between probable and confirmed for the average person is nil, because they will be treated the same as being positive for COVID, and they should take those necessary precautions and self-isolate, again, for a minimum of 10 days, help us identify those close contacts. We're really encouraging people to be proactive about that themselves and notify their close contacts upon getting that positive test result so that we can have people quarantining if necessary.
Next question.
Jeremy Fugleberg, Forum News Service.
Go ahead, Jeremy.
Hey, you mentioned last week about plans to add some more granular hospital availability information on the website. I just wondered if you had a timeline for that.
Well, Jeremy, it is actively in the works, and so it is imminent that you'll be seeing more of that data on the website.
Okay, thank you.
This is Joe with the Argus.
Go ahead, Joe.
With these antigen tests, I suppose these long-term care facilities are doing dozens, if not, 100 a day, depending on what's going on. Are negative results sent to the state? Are those, tallied up in the percent of positive numbers?
The negative test results are reported to the state.
That is correct. Now, I feel one of the things I do want to call your attention to is when you're looking at the trend tab, you'll see the change to the percent test positivity. That now specifically calls out the use of those RT-PCR tests, and that is very much in line with the way CDC and CMS are calculating that percent test positivity, that they're, at least at this point, only using the RT-PCR tests for that calculation. And so we do anticipate additional guidance, coming forth as we look at implementation of those tests in multiple states.
Next question.
Ray from Kelland.
Go ahead, Ray.
Hi. Do you have time to talk a little bit about nursing homes to follow up, because antigens are part of the reopening, so are the standards. Can you shed some light on how that's going to be the new? I'm getting incredible feedback. I'm sorry. The Centers for Medicaid and Medicare guidelines.
Sure. So as we've talked about before, the Centers for Medicare and Medicaid Services have put out some requirements for testing of staff in situations where facilities are located in counties. The level of testing depends on the positivity rate in those particular counties, and the federal government is making those additional testing resources available to nursing homes to help them meet those requirements.
Next question.
Jack Connell, KEBN and KOTA. You mentioned that the PCR tests are the only ones used to calculate the positive percentage for the day. Are those numbers lumped in together in that total test with the other type of test, or is there a specific number for the number of PCR tests that are done in a particular day?
So, so as you'll see on the website, we do call out the number of those RT-PCR, those confirmed tests that we're reporting new for the past 24 hours, as well as those for those probable or that antigen test on the website. So you'll see the numbers of those different platforms reflected in the dashboard. It's just that only those RT-PCR tests are specifically used for that percentage of test positivity calculation. So the focus here is that it's going to be RT-PCR positive tests over the total RT-PCR tests that were reported in that time frame, the 1 day, the 7 days, the 14 days, and cumulatively. So we do need to keep the same test in that numerator as well as the denominator.
So is the 309,841 tests, does that include both types then, added together?
So for the total tests that have been performed, you are correct that is including both those PCR as well as those antigen tests.
All right, next question.
And the probable cases are included in the active case count, correct?
So yes, so as it comes to the website, all the information that is there with the new total cases today, and that is broken out specifically between the confirmed and the probable. The active cases and the recovered cases include both the confirmed and the probable. And so one example for the number of new hospitalizations today, we had 27 total. Now 11 of those were probable cases and 16 of those were from confirmed cases. And so when you're looking at, if it doesn't specifically call out confirmed or probable, that use of the word cases or use of the word tests includes the PCR confirmed cases and tests and the antigen probable cases and tests.
Next question.
Ray from Kettleland.
Go ahead.
So, Dr. Clayton, given what you've explained about the tests and how probable and confirmed are included, would you expect the probable qualifier to be removed by federal officials or city officials at some point?
I mean, I think the case definition that we use is part of that national surveillance case definition. And so that is, kind of under constant review, and maybe is the best way of putting it, based on how COVID-19 is emerging. And so, it is very possible that in a future revision of that case definition, we would have confirmed cases include those rapid antigen tests. But right now there is that separation, there is that difference of how they can classify confirmed from probable cases.
All right, we have time for one more question.
I'll take it if no one else wants it. Go ahead, sorry.
I'm trying to square, it looks like we have, it shows new cases were outpaced by recoveries today, but our active cases also went up. I'm trying to square how that's possible. Can somebody hold my hand through that?
So, yeah, I mean, the number of, so today, I mean, when we're talking about the total number of cases that were added today and the active cases and the recovered cases. So when we were talking about the increases, that we saw today, that includes those probable as well as the confirmed tests. some of what those new hospitalizations, those new deaths, the new recovered, and those new tests are that catch-up of those 11,000 probable tests that were reported in the numbers today. So we're catching up in all of that to now from tomorrow or today moving forward. All of our numbers for the active cases, for the recovered, for the total tests, for the total new tests will be based on both those rapid antigen and the confirmed and probable cases that we receive in the past 24 hours. But we have received over the past month a number of rapid antigen tests, and a number of those individuals ended up being, are now included in those active cases, those recovered cases, and those total cases.
All right. Thank you all for joining us today, and we will visit with you next week. Just a reminder, because of the holiday weekend, our schools update will be posted on Tuesday.